nerve supply of the scalp. So scalp is supplied by 10 nerves on each side. So each side na left side and right side. Okay. So the auricle da neenga common point eduthukano. You see the next picture. This is the auricle or pinna. Take the auricle as the common point. In front of the auricle pathina 5 nerves. Behind the auricle 5 nerves. Adula 5 nerves la 4 nerves vandu sensory, 1 is motor. And here also 4 sensory and 1 motor. So 4 sensory, what are the 4 sensory nerves? Supratrochlear nerve. This is supratrochlear. And supraorbital nerve, zygomaticotemporal nerve, auriculotemporal nerve. This is sensory. Motor in the temporal branch of the facial nerve. Then behind the auricle, 4 sensory. So greater auricular nerve from cervical plexus. Then you can see the lesser occipital nerve from C2. Then greater occipital nerve from C2. Third occipital nerve from C3. The motor branch here is the posterior auricular branch of the facial nerve. So in front of auricle 5 nerves, out of this 4 sensory, 1 motor. Behind the auricle 4 sensory, 1 motor. Okay. I think you are clear with this. Next, we'll go on to the blood supply. So, blood supply will be of the scalp is by 5 arteries. Okay. So, here in front of auricle, 3 arteries. Behind the auricle, 2 arteries. So, what are the 3 arteries in front of the auricle? The first one here, you know, the nerve supplying is supratrochlear nerve. Similarly, it is supratrochlear artery. And the second one here is the supraorbital artery. And in front of the auricle, the third one is the superficial temporal artery. So superficial temporal artery is a branch of the external carotid artery. Supratrochlear and supraorbital are branches of the ophthalmic artery. Okay, which is a branch of the internal carotid artery. Okay. And behind the auricle, 2 arteries, posterior auricular artery and occipital artery. These 2 also branches of the external carotid artery. Okay. I think you're clear about the blood supply of the scalp. So next we'll go on to the venous drainage. So you actually the artery will be accompanied by veins, same vein, supratrochlear vein, supraorbital vein, superficial temporal vein, posterior auricular vein and occipital vein. In this picture, you can see this is the supratrochlear vein, supraorbital vein, and you can see the superficial temporal vein. Behind the auricle, you can see the posterior auricular vein, and the occipital vein also comes from the occipital side. So this will all drain the scalp region. Okay. So actually, if you see in infants, the veins of the scalp will be easily seen deep to the skin. That's why for intravenous infusion, they will use the scalp. Okay. So getting veins in the arm and limbs are very difficult. That's why they will choose the scalp region for intravenous infusion. Okay. And emissary veins are already explained. It is an emissary vein connect the intracranial venous sinus to the extracranial veins. It equalizes the pressure, and actually any infection in the extracranial site will be transmitted to intracranial venous sinus through emissary veins. One more veins are present in the skull. They are the diploic veins, because skull bone consists of 2 layers, outer table and inner table. In between, diploic tissue will be there. This consists of diploic veins. So the diploic veins are present in the frontal region, which drains into supraorbital vein, and the temporal region, anterior temporal vein, posterior temporal vein, and occipital diploic vein. Okay. So if you see the lymphatics, the anterior part of the scalp, it drains into preauricular, that is parotid group of lymph node, and posterior part of the scalp drains into mastoid and occipital group of lymph node. Okay. So with this, I think